Just imagine, a little while after finishing your meal, you feel a burning sensation right in the middle of your stomach, just below your chest. Not exactly chest pain, but that familiar stomach ache, uncomfortable and irritating, and gradually it becomes a cause for concern. You start thinking it might be acidity. But the pain keeps coming back again and again, and then the question arises, is it really just indigestion behind this? Today, we'll understand everything in very simple terms. What exactly is this area? Why does pain occur here? Which types of pain are common? And which ones should never be ignored? In this video, we'll talk about what epigastrium is, why pain occurs in the upper middle part of the abdomen, what this pain feels like, and the most common causes of this pain. When should this pain be a cause for concern, and when is it extremely dangerous? How do doctors figure it out? What tests might be needed to determine the cause of the pain, and what can you do at home for temporary relief? This entire script has been written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, let me remind you to subscribe to this channel right now to get more simple, science-based, doctor-reviewed health videos like this one. Let's start from the very basics. The epigastrium is the upper middle part of the abdomen, located just below the breastbone, called the sternum, and just above the navel. This small area is surrounded by some of the body's most important organs: the stomach, the first part of the small intestine, the pancreas, the liver, and the gallbladder are all nearby. Even major blood vessels are located here, so pain in this area doesn't have just one cause. Now, let's talk about how doctors try to understand this pain. The most important thing is the history, that is, the story of your pain. How long has it been happening? Did it start suddenly or gradually? Is it always there, or does it come and go? Is it a burning, gnawing pain, or does it feel like a sudden stabbing sensation? Does it get worse at night? Does it decrease when you sit or lie in a certain position? Does it increase or decrease after eating? Along with the pain, do you feel nauseous, have bloating, weight loss, or changes in your bowel habits? Doctors also ask about pregnancy, alcohol consumption, and mental stress. Whether there is a history of obesity or regular use of painkillers. Next comes the examination. First, it is checked whether the patient appears very ill, signs like sweating, paleness, or severe pain, fever, pulse, and blood pressure. These basic details often provide important clues. During abdominal examination, it is checked whether pressing on any area increases the pain. If the pain suddenly intensifies when the pressure is released, that can be a dangerous sign. The abdomen is also checked for any lumps or hernias. Epigastric hernias are quite common, but if they become trapped, it can be serious. Signs of liver problems are also looked for, such as yellowing of the eyes. Small red spots on the skin or water retention can also be signs. Now, let's talk about the most common cause. Stomach acid. Most epigastric pain is due to acid-related GERD or gastroesophageal reflux. Not only does it cause heartburn, but it can also cause pain in the upper abdomen. Sour water rising in the mouth, burning in the throat, and a dry cough are also symptoms. All of these can be factors. Being overweight, smoking, alcohol, coffee, pregnancy, and mental stress all increase the risk. Gastritis is also very common, which means inflammation of the stomach lining, and the pain usually worsens after eating. It generally improves with acid-reducing medication. In such cases, tests are done to check for the presence of a bacteria called Helicobacter pylori. If you have a peptic ulcer, the pain becomes even more intense. It feels like a burning or gnawing pain. With duodenal ulcers, eating provides temporary relief, but with gastric ulcers, eating makes the pain worse. The pain can wake you up at night. This is very classic. However, not all pain is harmless. Some causes can be life-threatening. In peritonitis, there is a sudden, severe pain. The abdomen becomes rigid and even coughing becomes unbearable. This is a medical emergency. If an aortic aneurysm ruptures, the pain radiates to the back or groin. It can even lead to sudden loss of consciousness. During pregnancy, severe epigastric pain may be a sign of preeclampsia, especially if accompanied by vomiting or headache. In pancreatitis, the pain radiates to the back and vomiting occurs. Many people feel some relief when they lean forward. Unexplained epigastric pain, accompanied by weight loss or new-onset diabetes, should raise suspicion for pancreatic cancer. In gallbladder problems, there is persistent pain, fever, and vomiting. Sometimes jaundice is detected. Even a heart attack can sometimes present solely as pain in this area, especially in diabetics or women. In children, the picture is a bit different. Functional dyspepsia is very common. In abdominal migraine, there may not be any headache, only abdominal pain. Mesenteric adenitis occurs after viral infections, and recurrent abdominal pain in children is real, not imaginary. So, what tests are done? H. pylori test, blood test, ultrasound, CT scan, and endoscopy if needed. The treatment depends entirely on the cause. Often, just changing your lifestyle helps. Eating small meals, reducing alcohol and smoking, sitting upright after eating, and managing stress. Antacids, H2 blockers, or PP, provide relief for many people. If bacteria are present, antibiotics are needed, and sometimes procedures or surgery may be required. Finally, one thing is most important. Epigastric pain is very common. Most of the time it's harmless, but sometimes it's a warning that can save your life. Vomiting blood, black stools, severe chest pressure, yellowing of the eyes, fever, or sudden unbearable pain. Never ignore these symptoms. Listen to your body, keep a record of your symptoms, and if in doubt, consult a doctor. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK. Information has been collected from medicine specialists, diabetes and hormone specialists, as well as from trusted medical sources such as Mayo Clinic, Cleveland Clinic, NHS UK, and others. If you find this video helpful, please subscribe and share, because good health begins with awareness.